Hey everybody, my name is Dr. Dawn Andalone. I'm a women's health physical therapist with level 4, and I wanted to come on to tell you about a common question that I got asked probably like 4 times in the last 2 weeks. And most of these women were about 3 months after having their baby, some were sooner, and they want to know, when is it safe for me to go back into my old fitness routine? Whether that's CrossFit, going to Pilates or running. A lot of these women are feeling like, and I felt the same way, I had a 9-pound baby, is that their core muscles feel like jello now. They're not sure if their pelvic floor muscles have gone back to the way they were before, and maybe they're having some bladder leakage problems when they cough, sneeze, or jump, or they're just concerned that going back and their activity was so intense, they're not sure if their body is ready. So some of the things that I like to advise women I see, obviously every woman is going to be a little bit different, and I'm going to take an individualized approach, but there's things to watch out for. So number one is you want to make sure that your bleeding has stopped. Obviously that means that your healing has not taken place. And if you had a C-section, especially waiting till at least 6 weeks after having the baby. Another thing is staying hydrated. You want to make sure you're getting enough fluids, especially if you're breastfeeding. And this is important if you start exercising and you're going to lose fluids. You want to make sure, because that will help the healing process as well. And then the questions I get about your core, doing abdominal exercises, and a lot of women aren't sure what's safe to do afterward, or why that belly bulge looks like they're still pregnant, or it's not going down. They're seeing a little bit of a ridge there, which means some women, after having babies, especially larger babies sometimes, is you develop what's called a diastasis recti during pregnancy that doesn't always heal itself. So working on exercises with a lot of twisting or crunching, or a lot of planks, those exercises can actually be detrimental to someone that has diastasis recti. So consulting with a women's health physical therapist to give you the right guidance, the right type of exercises to do, is going to be really helpful. Also, pelvic floor weakness or pelvic floor issues where you're getting some leaking with coughing, sneezing, running, or jumping. That means a couple different things. You could have some weakness there still in your pelvic floor. You could still be healing. So easing back into those higher intensity exercises and getting some guidance from a pelvic floor physical therapist and learning the right types of exercises, because Kegels aren't always the answer and aren't always the way to cure that. So getting some guidance and also easing back into a fitness routine with things like walking or swimming that's not putting a lot of pressure on your pelvic floor. And then also you have to just be able to not increase that intra-abdominal pressure, because that's going to press down on the pelvic floor area and put you at risk for things like pelvic organ prolapse, which can happen if you lift something too heavy or you put a lot of pressure down on your pelvic floor if things aren't healed yet. So those are a few of the common tips that I give my clients, and if you have any other questions or want some guidance about what to do, I'd be happy to talk with you. Our number is 760-503-4440, or feel free to browse our website at the Women's Health page at level4pt.com.